Welcome back, everyone. So glad you're joining me. And joining us this morning is Dr. Andrew Pope from the Kansas Regenerative Medicine Center to talk about regenerative medicine and stem cell therapy. And this is really incredible. I know you've heard a lot about stem cell therapy and what it can do in different cases, but tell us what you guys actually do and who you help.
Well, yeah, that's a great question. Simply put, regenerative medicine is really taking a living cell or tissue with the idea of repairing, replacing, or trying to regenerate new tissue so you can help the patient regain lost function. That's the goal.
And you help a lot of people who suffer from arthritis.
That's correct. We treat a lot of different conditions, but the number one thing that we treat in our clinic is some form of arthritis, whether it be osteoarthritis, any kind of degenerative arthritis. There's a lot of forms that arthritis comes in. And so we do individual consults with each patient to figure out, are they appropriate for us? Do we feel like we can help them?
And how does it work? That's what we want to know, because is it a big procedure? Are they out of work for a while when this happens, or is it pretty easy?
You know, it's truly a minimally invasive procedure, and it's an outpatient procedure. Typically takes about 3.5 to 4 hours. They're in, they're out the same day. They walk into my clinic under their own power, and they walk out of my clinic under their own power. Absolutely. So I have a lot of patients that are able to go back to work and go back to their quality of life after we treat them. But I always put a few precautions out there as far as if you're treating arthritis, what not to do, what to do.
Yeah, tell us a little bit about the procedure, where you get the stem cells and how you do that. How do you go about it?
Yeah, there's a lot of different ways to do stem cell or regenerative medicine therapies. We do adipose derived. We feel that for us has got a lot of benefits, and we feel like it's superior because I can pull it out very quickly, very easily, and I can concentrate a large number of those growth factors and stem cells that we're trying to get to go to the area where the damage is and heal it up. So it's minimally invasive. It's pretty simple to do, relatively speaking, from a medical standpoint.
Because you were kind of saying earlier, like they may come in and they take the stem cells like from your fat, right?
That's
from your
correct.
Hip or somewhere.
Absolutely. Yeah, and everybody always comes in, they worried, like, well, do I have enough fat? Or, hey, take as much as you want,
Yeah,
doc.
that's what I was going to say.
They're always disappointed because I don't take that much, because I don't need that much. And I always tell them, you don't want to waste that. There's so many precious cells within that. So I only take what I need. And the patients within a couple months can't even tell that I did anything.
Really? So let's say you take it out here, and let's say I have arthritis in my hand.
Yes.
Okay. So you take it from here, and then you would put it where I have the pain.
Yeah, I have an ultrasound, so what I'll do is where we know the problem is, and I can usually get enough cells to treat more than one joint. So we'll go in under ultrasound guidance, I'll isolate the issue, and I'll place those cells and growth factors right where they need to be. That's the whole point. Take them from point A, put them to point B, and let them go to work.
Isn't that incredible? Medicine and science, how it's evolved. Now, you have had several success stories where you've seen people come in, have severe arthritis, and then you do this procedure and you see them really benefit from this and get back to their life.
Well, absolutely. It's one more great, it actually addresses the underlying problem. Too often, all I'm able to do is put Band-Aids without actually treating the disease. This gets to the root of the disease and gives us a chance to treat them. So a lot of people come in with the idea of avoiding a surgery or some invasive procedure.
Yeah.
Sometimes I can help them do that, and oftentimes I have patients that are 3-4 years out now that were destined for a replacement, told that was their only option, and they're still walking on with their own knee, and we've prevented that. Now, not for everybody, and I'm not going to say that as a one-size-fits-all approach. You've got to take it case by case.
And tell people where you're located.
Yeah, we're currently in Manhattan, Kansas, as well as a new location in Overland Park, Kansas.
Okay.
So we've been expanding.
Yes, well, thank you for joining us this morning.
Thank you for having me.
I love it. And we will be right back, but here's a little bit of more information. They are in Manhattan, and if you would like to contact them, they can go to
www.kansasrmc.com.